My name is Dr. Lee Schofield. I'm a member of the OMA section on sport medicine, currently sitting as the vice chair. I'm also a primary care family physician in Toronto, Ontario, with a focused interest in sport and exercise medicine.
Hi there, my name is Dr. Lindsay Bradley, and I am a sport medicine physician in Ottawa and chair of the section of sport and exercise medicine of the OMA. As the section of sport and exercise medicine, physical activity for health is a huge mandate of ours. So we really want to give people just some advice on how they can practically just start doing it.
Canada's physical activity guidelines recommend presently that adults have 150 minutes of moderate to vigorous exercise in the course of a week.
Now with COVID, we know that working, caring for children, ensuring our families stay healthy, physical activity is often one of the first items to fall off the list.
What I would like to highlight is the importance of finding something that you enjoy so that you're more likely to stick with it and stay physically active during this time. We certainly have equipment and items around us that can help you to stay physically active. If you live somewhere that has stairs, you can use your stairs to get your heart rate up and add a little bit of intensity.
Put on a backpack that's got a little bit of weight to it and do the stairs with that, or take a water bottle and fill it with water, or even freeze it to give it a little bit of weight to it. With the spring weather approaching, we know that everybody wants to get outside, and we encourage that as well.
If you are choosing to walk or run or use a bike, there's certainly an option of using a mask for your personal protection. This topic has been in the news over the last few weeks, and currently the Ontario Ministry of Health is recommending that people wear masks if they're not able to socially distance when out in public.
The guidelines are suggesting that if you're going to be walking outside in the same direction as sort of neighbors or other groups, that you should try and be at least 4 or 5 meters away. For running or slow biking, again, trying to physically distance as much as you can. So 10 meters if it's possible, and hard biking a little bit farther apart, maybe about 20 meters. We know that there are certain populations that already have barriers to physical activity, especially children or adults with a disability. We know that physical activity can be challenging for this group in the best of times. And we know that our current landscape of restrictions actually makes this even much more difficult.
There are resources online to help support these groups and these specific challenges that may need to be addressed for people being physically active. For example, the Canadian Disability Participation Project has reopened their Get in Motion program, which helps to connect adults with physical disabilities with a fitness coach and staying active. For patients that are pregnant, a local hospital in Toronto has created a pandemic pregnancy guide, which includes recommendations on physical activity during pregnancy and during the time of COVID, but also provides online live classes for meditation, stretching, and other things that people may be looking to access from home.
So our main sort of goal and teaching point here is just to find something you enjoy, find what works for you, ease into it if physical activity hasn't been part of your regular routine up until now.
Primary care providers and sport and exercise medicine physicians are available to help answer some of your questions and give you guidance on staying physically active if you are feeling well or having symptoms that you are concerned about.